Welcome back to OpenLine. We are so glad to have you with us because it's an important topic tonight. We have Dr. Spyros Kalams with us from Vanderbilt University talking about the ever-evasive, pertinent topic of COVID-19 and what it means going forward and where we've been as well. Right before the break, Dr. Kalams, we were talking about the difference between this illness, this virus, in vaccinated versus unvaccinated. Talk about what you've seen, on the very front lines of all this.
And I'll try to do it. Well, chronologically is always a good place to start. When we started the vaccine trial, and it was always designed to look at 2 vaccinations, and it was what's called a randomized double-blind trial. So at our particular site, we enrolled almost 500 people between 2 groups of investigators, and so half got vaccine, half got placebo. And this trial was 30,000 people across the country, and it was really meant to see who developed symptomatic illness. And of course, and then different ranges of symptomatic illness. So we didn't swab everybody every single time they came in, but if they felt like they were getting sick, we did. And then we tracked who went to the hospital. And that's where you hear those statistics. What does it mean to be 95% efficacious, or it works? And we were hoping we were going to get 50%. That's what we were gunning for. Whenever you design a clinical trial, you have to decide, okay, how many people do I need to show in each group to convince us statistically and rigorously that the vaccine actually worked? And as people might know from flu vaccine studies, the flu shots often aren't that effective at preventing severe illness. I mean, if they're 40 or 50%, we're kind of okay. I wish it was better, but that's what would be like a decent response. Well, this was 90, 95%, so it was as a home run as far as we were concerned. So what does that mean? It meant that if you were going to have 100, let's say you were going to have 100 cases of people with pretty significant illness, some of them requiring hospitalization, in the group that got the placebo, we were only going to get 5 or 10 cases in the group that got the vaccine. So that's a 90% reduction. And that math was just pretty astounding and convincing. So that's how and that's always held true. Now, even now, and I don't want to jump ahead too far, but even through the Delta wave and all of those, the people who were vaccinated who had illness had mild symptoms. And mild could be, yes, enough that your head is stuffy and you're home and you need chicken soup, versus landing in the hospital and requiring supplemental oxygen or being in the intensive care unit. That difference between the vaccinated and the unvaccinated has held up even through Omicron. If you look in the hospital, in our hospital or across all hospitals, even through the Omicron epidemic, the people who'd been vaccinated, and if you look at people in the hospital, the ones who got vaccinated tend to be, they got swabbed when they came in and they happened to be positive. We find SARS in your nose, and a lot of those people, I came in with a broken foot. Yeah, well, you got SARS in your nose. If you look at the people who are in the intensive care unit, those are the ones that hadn't been vaccinated, or they had conditions that just didn't allow them to make a good immune response to the vaccine. Let's say somebody who had a kidney transplant or has some underlying cancer, or you say leukemia, something that would affect their immune system, or they're on chronic steroids or something for, it could be anything, lupus or rheumatoid arthritis, something that would blunt their immune response. That's held up. And the other thing I can say is that the 2 vaccinations were great up and through Delta. Now we hit Omicron. So, and we know that the vaccine was not made for Omicron. It was made for the earlier variants. Now, I can't say we, Moderna and Pfizer and other vaccine manufacturers, I guarantee will be coming out with vaccines that are more specific for what's been circulating. But Omicron is different enough that the vaccine definitely does not work as well. But as a rule of thumb, I will say that the 2 shots plus the booster are as effective for Omicron as the 2 shots were for the other variants. So you see that same pattern. The people who were just starting to get their shots or got their first or second shot who got Omicron got really sick. The ones who had gotten their shots and the booster were the ones that had the sniffles. And it's like night and day. And we see this in the hospital all the time.
Absolutely. We've got a call in from Lisa with a comment or question. Lisa, go ahead. Welcome to OpenLine.
Yeah, thanks for taking my call. I have a couple of questions for the doctor. I wanted to find out if he has started to dig into the first 75,000 pages of the Pfizer data that has been released per the court order, and what he thinks about the fact that they redacted the number of people that the vaccine was given to, and only told us the number of deaths. And so what does he think about that? And is he going to talk about therapeutics in the show at all? And are they still giving a lot of remdesivir at Vanderbilt? I'd like to know that. From what I've heard, the nurses jokingly call remdesivir run, death is near, because it turns out that you have a bad outcome on remdesivir. So I guess those are my probably my only 3 questions. I could ask a lot of questions more, but we'll start there.
Awesome. Lisa, thanks so much for calling in. Doctor?
I had to say, I'm not aware of the Pfizer redacted data, so I need more specifics. I don't crawl into what I certainly know the published work and the effectiveness of the Pfizer and Moderna vaccines. They're both very good. I got the Pfizer vaccine, so that's what, even though I tested the Moderna vaccine, Vanderbilt made the Pfizer vaccine available to employees. So I think they're equally good. And if you got 2 shots of Pfizer and a Moderna was for your boost, I'd feel very comfortable doing that. So I don't know what the caller's talking about with the redaction, but
sure. On the second part of her question, talking about therapeutics, how has that strategy changed within the hospital?
I think remdesivir, I think we're still trying to figure out exactly what the role is. Remdesivir works it works reasonably well the earlier you give it. I think all of these drugs are like that. You know, if you could give some of these drugs when you first have symptoms, they certainly work better. They're safe. They don't cause bad outcomes. I mean, they're very well tolerated. So I think that, but by the time a lot of patients are in the hospital, again, especially the sickest of the sick, a lot of the damage that's happening, a lot of the reason you can't breathe is not only because the virus has done damage, but your immune system is trying to fight the virus. And when that war is going on in your lungs, it gets in the way of doing the lungs' job, which is to exchange oxygen. So at that point, it's really hard to make a dent. You can clear all the virus you want, but you're still dealing with the damage that's been done. So that's why I'm a big fan of vaccines over therapeutics, but I think some of the newer drugs out there with the pills might be much better, but again, early treatment might be the way to go. But
absolutely. We heard from Lisa. You too can call in. The number is right here on your screen, making sure I get it right there. We're going to have to fit in a break real quick, but we'll have more just after the break.